right, we are continuing our 988 series today, and we know it's been 4 years since this crisis lifeline launched. Joining us right now, we have Kendra Tolber. And when we talk about 988, a lot of people think it's, it's a phone number you can call, but you can also text it. So talk to us about what exactly you do on the other end of the phone.
Yeah, certainly. So, you can text in or on your phones or on your tablets, computers. And once you do that, you will connect to a clinician, such as myself or other peers. And then from there, we just talk about what's going on. We want to figure out what brought you to this line. And from there, we will, ask questions. Sometimes it can be hard for people to open up about some of the difficult things that they're going through. So we kind of help guide that conversation, ask some questions, and then from there, once we start to build a little more rapport, people are more apt to opening up and talking about what's going on.
Now, it seems more challenging to be on the texting end of things rather than a phone call when someone's in a crisis. So what are some of the challenges that come up with that?
Certainly. So, obviously, we have to ask a lot of clarifying questions because, as we know, texting is different than talking. And so we will, ask clarifying questions to understand what is going on. And that leaves room for the chat visitor, is what we call them, to correct us if we're wrong. And so from there, we just kind of go back and forth like a normal text message.
And how long do these chats normally last?
Certainly. Anywhere from maybe an hour to an hour and a half, but it kind of depends on the need of our chat visitors. So sometimes it could be shorter, sometimes it can be longer, but we're there for whatever it is that they need in that moment. So,
what made you want to do this?
I feel this is incredibly important work, and I believe that no one should ever have to struggle in silence or alone. And so I wanted to be a part of a service that when someone connects to the line, they are connecting with someone that is wanting to listen and support them, and just be there in some of their darkest moments. So, ideally, we want to make sure that, they're heard, supported, and, how do we help find a path forward?
And what are some of the most common questions that people have for you?
Yeah, so there's a lot of questions, and they can vary from, what resources might be in the community. Sometimes it's others reaching out for their loved ones, so they want to know how to support them. And so for those type of questions, I often guide them to our 988lifeline.org website. On that website, they have a beautifully, easy, accessible website where they can learn just different tips on how to support their loved ones. And it's not as difficult as one might think. It's simply just being there in the moment with someone, validating, acknowledging, and, trying to stay calm, with them.
For a lot of people, reaching out to 988, it could be challenging, overcoming a hurdle personally for them. So is texting a really great option for them if they just feel a little shy about being on the phone?
Absolutely. Our chat and text feature is probably our most busiest line, because it gives people the ability to speak freely and not have that anxiety of phone conversations. We've learned that, a lot of people prefer texting over phone calls. So I definitely think that the chat text feature it continues to grow and expand.
Okay.
And we heard earlier this week from someone who's used this service, but said she called and she talked about how the operator on the other end of the line, the clinician, was, worked through that process of how do we make a plan when it comes to making that text message instead of making that call. How does the service differ at all? And also, what are some of the challenges that are presented by you who is doing this over a text communication instead of, voice?
Sure. So the way in which we would navigate those situations, whether call or text, are the same, and ultimately when we're upon connection, we're immediately trying to listen and understand what's going on. And so it can be challenging at times through chat and text because it does take a little longer to, just in general, it takes a little longer to get through all of those things, but there's really no difference between how we operate on both of those lines.
I feel like the texting version of that, it can be more preventative work as well, not just someone in an immediate crisis.
Absolutely. Yeah. So not everyone that contacts our line is like imminent risk. Sometimes people just need an outlet to vent and just a space where maybe they're not ready yet to talk to their friends or their loved ones. So it does make it a little more maybe informal in a sense to be able to text just, hey, I'm having a bad day and I just want to process and talk.
How do you take care of your mental health doing this? Because I'm sure a lot weighs on you.
Yeah, I am very big on self-care, walking, journaling, all of those fun things to just decompress. But, I do find a lot of honor in being able to be there in some of people's most darkest and difficult moments of their lives, and hopefully help them find a path forward. So,
Awesome. Thank you, Kendra.
yes, absolutely. It's a pleasure.